Dr. Carol Gray Brunton of Edinburgh, Napier, University, Scotland, recently authored a blog post for evidence-based nursing on the subject of vaccine hesitancy amongst nurses and other health and social care professionals. This blog, which summarised findings from an as yet to be published mixed method study, reported that around 10% of participants had not received any COVID-19 vaccines. Further, those who refused vaccination held strongly negative views about the vaccine. Now, given the importance of vaccination in controlling the impact of COVID-19 and giving Nursing's claim that it's an evidence-based profession, many people will be surprised, if not shocked, that so large a minority of nurses and other health and social care practitioners rejected vaccination. That is, they rejected scientific advice regards the individual and social benefits of vaccination. Hello, my name is Martin Lipscomb and I'm joined by critical health psychologist Dr. Brunton, who has kindly agreed to discuss her blog post and the study that underpins it. Carol, thank you for agreeing to talk to me. Please, would you describe your work?
Thanks so much for inviting me, Martin. I'm delighted to be here to talk a little bit about this blog and that you refer to. We'd written that up for our funding body and a report to which you refer. And I'll just mention our funding body as the Royal Society of Edinburgh, a research reboot COVID-19 impact research grant. So, I'll tell you a little bit about the study. You're absolutely right. I mean, we know that the World Health Organization lauds vaccination as one of the most successful public health interventions, doesn't it? And obviously nurses and other health and social care professionals, play a pivotal role. They're trusted sources of information. The public relies on them. We have the other issue affecting public health, of course, is the notion of vaccine hesitancy, which is defined as delays or refusals to be vaccinated for a variety of complex and context-specific reasons. We know that the COVID-19 pandemic really brought the vaccination effort to light, didn't it? It really thrust the speed of which a vaccination was needed to protect us all, but at the same time, the important role that people like nurses and other frontline healthcare staff who were working facing the public and how they needed to be protected because of the risks they were posing to their own health. But we also know, so say, for example, in Scotland, we know that sometimes previous public health efforts to vaccinate our staff, for example, against influenza, the annual influenza vaccine, don't always achieve the uptake rates required, even though, they are protecting against the risks that staff take with getting flu every year. So the aim of this study was really just to look at a little bit more detail around vaccine hesitancy, vaccine confidence amongst these frontline staff, such as nurses and other healthcare professions. And so we conducted this online mixed method study. And the first part was a online survey. For those of you interested, that was we adapted Freeman et al.'s 2020 survey of the 7-item COVID-19 vaccine hesitancy scale and the 14-item vaccine complacency and confidence scale. And with permission from the authors, we adjusted a couple of those items to suit our health and social care professionals audience. And we also did some qualitative discussion groups to try to unpick some of the reasons underlying why staff or those I should mention some were in training, so they were students, and so why they might be delayed or refusing to have a vaccine themselves. And following informed consent procedures, we transcribed those online discussions and analysed them using thematic analysis. So just break down the results a little bit there. From our quantitative survey, we used 49 fully completed surveys from the 57 partially completed ones from one Scottish university, large university. And nearly 90% of our participants there reported that they'd, at the time of the study, which was July to September 2022, that it had at least 2 vaccines with COVID-19 and reported positive views on the attitudinal scales for vaccines and for the COVID-19 vaccine in particular. And we had about 10% of our participants who had reported that they hadn't received their 2 doses of the COVID-19 vaccine and had strongly negative views for that. When it came to the qualitative results, we had participants from a range of different professions. So you had your midwives, your child health nurses, adult nurses, learning disability nurses. And overall, perhaps unsurprisingly, most people were really strongly in favor of vaccination, and most were positive about the COVID-19 vaccine, particularly. Some concerns were expressed, and these were around certain areas. And here our participants talked around their personal and professional encounters, so whether they were asked by a neighbour in a less formal capacity or whether they were working in a more frontline role. And the concerns were around things like this idea of overloading the system with too many vaccines at once, so maybe having a flu vaccine and having to have a COVID-19 vaccine at the same time. There were other concerns around protecting vulnerable groups, and what the psychological or behavioral science literature calls omission bias. So rather than introducing a harm, you'd rather just kind of leave it and not introduce something that could be harmful to maybe a vulnerable group like a pregnant woman or an immunocompromised individual. And the other vaccine concern was around this idea of, well, some vaccines just weren't seen to be as important as others. So this idea of rating them or grading them. And so, for example, the influenza vaccine was seen as maybe not as crucial as some vaccines there. So largely taken as a whole, the results show that perhaps unsurprisingly, most people have been vaccinated from our study, most participants, most were positive, but there was a small minority who had reported that they hadn't, in terms of their behaviours, they obviously this is self-report, they reported they hadn't been vaccinated with a COVID-19 vaccine at the time, and they reported some strongly negative views. And this tends to parallel the general population, what's been found in their surveys.
Right. That's very interesting. Okay, you note the percentage of people in your study who refused vaccination is at 10%, roughly the same as UK non-professionals. Now, in one respect, that's unsurprising. For example, nurses come from a wide range of backgrounds, and their views and their prejudices probably mirror those of the wider population from which they're drawn. It would be odd if that wasn't the case. However, I am personally surprised that processes of professional education and indeed ongoing workplace enculturation haven't made a difference to the willingness of professionals to accept scientific argument, given that it's the same percentage in the general population as in the healthcare professionals. Now, of course, arguments are rarely conclusive, and differences in opinion and factual interpretation are commonplace, especially regards new and novel treatments. Nonetheless, given the weight of scientific consensus on the value and the efficacy of vaccination, as I say, I'm surprised that so large a minority of professionals refused vaccination. To me, this suggests that these people might have very different understandings of what science is and does than I do. Please, would you say a little bit more about this feature of what occurred? I appreciate your work isn't only about nurses. However, might those who are labelled hesitant, that is, those who reject scientific advice, be essentially unscientific in their outlook? After all, if they are as healthcare professionals, as nurses, that could be thought disturbing.
Thanks, Martin, for that thought-provoking question. I might not offer conclusive answers to that, but there's a couple of points I'd like to hone in on in response to your question there. First of all, you raised the idea of the novelty of the vaccine, and we know from the vaccination literature that novelty is always vaccine novelty is always something that is more likely to create a kind of what's been termed as vaccine hesitance. So when something's new, that can tend to be kind of more people are maybe sometimes adopt a wait and see attitude. I suppose one thing to say is you might be saying, from a critical perspective, looking at the study, you might say, well, the results are based on a kind of really small quantitative study? Are they really, you know, I don't want to say generalizable, but would this be the case amongst all our nurses and our other health and social care professionals? What I would say is, at the time we were conducting the study, there was a study which has been published in Nurse Education Today by Patalaru et al., which looked at nursing students across 7 European countries. And interestingly, at the time of the study, which was before ours, less than half of those nursing students would agree to accept a COVID-19 vaccine at the time. So that was really interesting. And we also know that the notion of vaccine hesitancy is quite high in Europe as well. So, and coming back to Patalaru's study, the factors that were related, it's quite useful to unpick some of those things that were related to the vaccine hesitancy subgroup. They had large numbers. We haven't got those very large numbers, but the factors related to being more willing to have a COVID-19 vaccine was, interestingly, being more highly educated, being of male gender. What else was previously not having worked frontline in the pandemic, so not working in that frontline position. Other factors were related to previously having received an influenza vaccine. So if you had previously received your annual influenza vaccine, you were more likely to have a COVID-19 vaccine. And having more trust in healthcare providers and in doctors and in science. So those were the factors there. But unpicking your point a little bit further, Martin, I think I want to return to the notion of evidence-based practice, because you're absolutely right. This could almost seem to suggest, based on the notion that nurses particularly, but not only nurses, midwives, those who belong and are associated with a professional body which abides with science, you'd think that this might be almost contradictory, that you'd be in kind of incompatible with your values role as a professional. However, I think it's useful if we unpick evidence-based practice a little bit further, and rather than seeing it as an absolute black and white area, I think it's useful to refer to what others from a kind of social science background or drawing from social science have referred to as more an information deficit model. So I'm interested by the study by Lehner et al. and published in BMC Public Health. They looked at midwives, and they looked at midwives' role in promoting their MMR vaccine. Now, you might recall the MMR, or the measles, mumps, rubella vaccine, in previous years has been very controversial, hasn't it? Although completely discredited, as in claims against it, and it's a highly effective and considered safe vaccine. But in the past, there was some controversy surrounding it. Anyway, returning to that study, the authors really emphasize that instead of seeing this notion of midwives being this vehicle to promote more science and give more information, to encourage their patients or their clients, rather, in midwifery terms, to have that bit more information to be able to make this informed choice, they saw themselves as more consumers of that information. So more, and that also reminds me of another study that we conducted, and that was Petrova et al. That was looking at HPV vaccine communication amongst our young women in 4 European countries. And our findings there were really that our young women needed to make sense of often contradictory information, but they needed to critically appraise that information for themselves. And when we think of the pandemic, the COVID-19 pandemic, the speed in which the landscape of information was changing, wasn't it? If we just think about how at one point the information for who was frontline, who was eligible, when, it was an ever-shifting landscape. So at the time, for example, pregnant women were not routinely advocated as receiving the vaccine, but that then changed. So in order to keep abreast with that shifting landscape, I think we really need to be sympathetic to our frontline practitioners in that position. If we also consider that working in education, like many of us are, and so that some of our participants were in training, as you like, it really reminds me of, or reaffirms the notion that we really need to put the emphasis on the critical appraisal of information. So it's rather than more information, it's the critical appraisal and sifting of that information, and how we equip our frontline practitioners like nurses and midwives to feel empowered and confident to not only address their own concerns, but also the people that are coming to them for trusted information, because it can feel like a minefield. And the other last point I'll just raise is that, last couple of points, is that we know that the context in which our practitioners work is so important, and the relationship is important. So I think it's very important that public health officials are mindful of the frontline workers, and that they take efforts to just equip those people to be as confident and as they can be in that moment, as we saw with a pandemic which was so swift. So much food for thought there.
And that was really interesting, and what an interesting subject. And as you say, food for thought. There's so much more here to unpack, isn't there? I do hope these studies continue. There's just so much more to think through and learn in relation to hesitancy. Thank you for agreeing to talk to me. And for those who would like to explore Dr. Brunton's work, a link to that work will be lodged in the note. Thank you. That was great. Thank you for your time.
Thank you so much, Martin.